Hello everyone, this is your surgery coding guru, and before we begin, please subscribe the channel. And today we are going to learn about the trigger finger release versus injection, the CPT coding for both of these procedures. So let's begin. So can you see where flexor tendon is written? So these are the tendons which go in the finger. So there are two tendons, flexor digitorum superficialis and flexor digitorum profundus. Superficialis is the superficial one, the top one, and below it is the profundus. So the superficialis bends our proximal IP joint, and the profundus bends our distal IP joint, right? Then the light blue color tunnel, if you can see the where the tendon sheath is written. So what is sheath? Sheath is the covering of the tendon. So what does it do? It has two layers, one fibrous layer, the outer one, which is a protective layer, and the inner synovial layer, which helps in gliding the tendon easily. It is kind of, you may say, lubrication kind of. So now over it there are rings, if you can see, where A1 pulley is written. So there are 5 pulleys: A1 pulley, A2 pulley, A3 pulley, A4 pulley, and A5 pulley, which helps in keeping this tendon and the sheath attached to the bone. If there will be no pulleys, then this tendon will not stick to the bone, which is very essential. And then there in between there are more pulleys, that is C1 pulley, C2 pulley, and C3. A is means annular pulley and C means cruciate pulleys. Okay. Now recap. What is tendon? Tendon is which connects muscle to the bone. Muscles of the forearm, tendons travel into the fingers, and tendons pulls the fingers to move them. Okay. What is tendon sheath? I've already told you. The tunnel over the tendon, and it has fibrous layer and synovial layer. These are the pulleys, the annular pulley and the cruciate pulley. Now, what happens in the trigger finger? So in trigger finger, because of the inflammation can be of the A1 pulley, then it may be of the tendon sheath, or it may be of the tendon. Any of it will cause trigger finger. What will happen in trigger finger? See, right now it is gliding smoothly. If there will be no pulley, what will happen? The tendon will not stick to the bone. So what is happening here is there is inflammation, and if you can see from the A1 pulley, it is not able to glide properly. This is how trigger, see, it is not able to bend properly altogether. So what will the surgeon do? Surgeon will give an incision over the A1 pulley and will cut the A1 pulley. See, basically A1 pulley is the part of the sheath only. Okay, so basically he is cutting the sheath so that the tendon can glide properly under the pulley. So what is trigger finger release? It is the incision on the tendon sheath so that tendon can glide. See, and then there is another procedure which is called as trigger finger injection. So this procedure is done before the surgery, and here the injection is given on the A1 pulley, the tendon sheath basically, not on the tendon. Always remember this. And there can be a nodule. See, a nodule in the tendon that is also one of the reasons that it will not glide properly under the A1 pulley. And always remember, the injection is never given in A2 and A4 pulley. They are very, very crucial pulleys. So it is always done on A1 pulley only. So now let's come to the operative note of trigger fingers. So there is pre-operative diagnosis. The post-operative diagnosis is the same. What is happening? Bilateral ring finger trigger fingers. So the patient has a ring finger trigger finger, and on the right side and on the left side, both. And what is the procedure performed? It is on the right ring finger trigger finger release. There is release, and on the left side they are giving injection. So both the procedure which I taught just now, so both are being done in the same operative note. Findings. What are the findings? The A1 pulley has been thickened. So, the patient is a pleasant female with a history of ring finger triggering that has been going on for quite some time. She has had multiple conservative treatment, but this continued to bother her. That is why she is here today for the procedures. So we marked out our planned longitudinal incision centered over the right ring finger A1 pulley. I told you where the surgeon gives incision over the A1 pulley. So we incise skin and subcutaneous fat. Of course, skin will be removed and the subcutaneous fat. The layers I have already taught you in another video. We dissected down to the flexor tendon sheath, of course. He reaches to the tendon sheath. Retractors were used to retract and protect the neurovascular bundles. Once we had good visualization of A1 pulley, 15 blade was used to release the pulley longitudinally in line with flexor tendons. I just showed you how they incise the A1 pulley. They make a cut on the A1 pulley. The tourniquet was let down and the hemostasis was achieved. So this is what exactly is happening in this operative note. What are they doing? They are making an incision on the A1 pulley, moving the skin and subcutaneous fat, and then they are making a cut on the A1 pulley, so that now, since the cut has made, so the tendon will glide easily. There is no ring on the tendon now, so the tendon will be able to glide easily. That's it. And what is happening on the left side? On the left side, maybe it must be lesser in degree, so that is where he's only giving injection there. So the trigger finger, we turn our attention to the left ring finger, trigger finger injection. Then a 25 gauge needle was inserted in the flexor tendon sheath. Remember, the injection is on the tendon sheath, the A1 pulley, not on the tendon. And what are they giving? Lidocaine and Kenalog. So what is lidocaine? Lidocaine is just for numbing the area, and Kenalog is the real treatment, which will help in reducing the inflammation of the tendon sheath. Now comes the CPT series. See, the incision is on the tendon sheath. That is why it is very essential to know that what is exactly happening in the procedure. So in the trigger finger release, they incise the tendon. That is why we will be using tendon sheath. And if you will see in the CPT book, you will find it under incision only. Now one more thing, 26055 is coded with RTLT. Why so? So it is because the incision is given on the hand, not on the finger. So that is why no finger modifier, but RTLT. Now this is the series for injection. So there are four CPTs. Now if you will see carefully, the 20550 says injection single tendon sheath or ligament or aponeurosis. For example, in plantar fascia. The second CPT is 20551, which is injection in single tendon origin or insertion. The third CPT 20552 is injection in the multiple trigger points, one or two muscle, and 20553 single or multiple trigger points, three or more muscles. So now, which one are we going to select for our trigger finger injection? So I have already taught you that the trigger finger is the condition of the tendon sheath. So of course we will go on the CPT 20550, which is injection single tendon sheath. The next one is also on single tendon, but it is on single tendon, not sheath. It is on the tendon's origin and tendon's insertion. On the other hand, trigger finger is on the tendon sheath. That is why 20550. Okay, one more thing. We use RTLT modifier or finger modifier or two modifier with 20550 or 20551 depending on where the injection is being given. And we use 59 modifier if we use the injection on interspinal level, because there is no left and right. That is why, to show the difference that it is given on different levels, we use modifier 59. And then 20552 and 53 is injection single or multiple trigger points, one or two muscles. So it is injection in the muscles, not in the tendon, not in the tendon sheath. So of course, trigger finger, it is not the treatment for trigger finger. What it is for? It is for myofascial pain. Like there will be knots or nodules in the muscles. Then we will be coding this series, the 20552 and 20553, and we count muscles in it, not how many injections have been given. And for 20552 and 20553, we don't use any modifier. Why? Because here it is given according to the number of muscles being injected. So count the number of muscles, whether in left or right, just count it and code accordingly. If one or two muscles, code 20552. If more than two, three or more muscles, then use 20553. No use of RT, LT. And these injections have in bracket the word S, means multiple injections can be given. And here are our codes: M65.341 for right side, the end, the one at the end shows the right side, and M65.342, that is for left side trigger finger. And the surgery done on right was trigger finger release. That incision was given on the tendon sheath. That is where 26055 right modifier RT and 20550 LT on the left side, because on the left side only injection was given.